Assalamu alaikum everyone. Welcome back to another episode of the Medical Talk. Today we have with us Dr. Aemaz Ur Rehman. Dr. Aemaz is a graduate of the King Edward Medical University, Lahore. He is currently working as a Post Doctoral Research Fellow at the Mass General Hospital, and we are very happy to have him here today. Thank you so much for joining us.
You're welcome. Thank you.
I'd like to start the conversation by talking about your early life a little bit. Where were you born and raised, and what did your early education look like?
I was born in Multan. My hometown is Multan in Punjab. And I studied from King Edward, which is in Lahore. So I was a hostelite for 5 years. For the second part of your question, it's a little tricky, but I'll try to be honest. My father was a doctor, so it's a funny story, but he's a doctor, but he asked me to not go into medicine, which was kind of different from what fathers and parents usually do. Yeah. But I mean, he had his own experiences, and which were, a little different. So he said it's not worth it to go all through the struggles. But I was stubborn, honestly. So I agreed to him, but deep inside, I knew that I had to, make an informed decision. Okay. So I just asked my father once that I want to, go with you to your clinic. So that clinic was not a hospital. It was a clinic you can call it a periphery in Pakistan. So not a lot of, educated people, or it was basically for the underprivileged class of our society. So I didn't know a lot about medicine, but what I saw was, as a kid, that what he was doing was meaningful, and the ability to help people. And people came in crying, Doctor Saab, hamare bacche ko ye ho gaya hai, isko theek kar de, I don't know what's happening. There were mothers who were really worried. So I just found it, meaningful, seeing all that. So that's when I thought that if I want to do something, it should be meaningful. And on the other hand, I was not fond of maths. So I did not want to study maths all my life. So that's when I decided that medicine may be a right fit. So I went against the advice of my father and asked him to let me study biology in FSC.
That's great. I think you're very passionate about medicine, so that is really nice. So how did you decide that you want to move to the US?
Yeah, so as I already told you that my father was a doctor, so I did have some idea about the USMLE and how it looks like, and how doctors go to US, and the medical training there is good. So I had it in the back of my mind when I was in med school. The other factor, I think, for deciding to pursue a career in US was when I went to wards in the third year, I think, of my medical school. I mean, no disrespect, but I did not like the patient care aspect. I mean, that's understand. Now when I look back, I understand, but back then I did not like how patients were being treated. There was no continuity of care. So it was kind of saddening for me. So and then there were some things in politics in my, medical fraternity, and I used to see it. I did not like it. So that's when I decided, no, I'm not the best fit to stay here. But having said that, when I look back, I have a lot of respect for the doctors who are working in Pakistan, because with the limited amount of resources that they have, they're doing the best that they can. So I do understand that now. I did not understand that back then. So that's how, and then the other major factor was the fact that I usually my father was a doctor, so I already coming from a family of who had a doctor, I had a certain amount of privilege.
Yeah.
So I was not the sort of person who wanted to, rest on laurels. I wanted to go one step ahead from where my father was, and that's why I decided to take, a little more challenging route.
Since you had it in the back of your mind since the first or second year of med school, what were the resources that you used for studying in first or second year before you took the USMLE exam? Were they oriented towards the USMLE?
I think that's a good question, because if you're going to do USMLE, you should. I always had it in the back of my mind. So I was always trying to study good books. I won't say that I started studying for USMLE back in first year and second year. I enjoyed that time, and I don't think that I regret it. I used to pass the professional exams, but I did not study much back then. But what I knew was that as people around me were studying, people used to study short books that are helpful sometimes as well in a different way. But I knew that I had to study Guyton for physiology, and with the intention of, studying good books so that it can help me in USMLE.
What do you think is the best time to start preparing for the step 1 exam?
I think that back when I was in my med school, it was fourth year, but now I see students who took it in third year before step 1 went pass and fail, and they were scoring 250s, 260. That was surprising for me, but I guess this is how the trends are changing. I would not say to, I would, because the med school time is not going to come back. Looking at my med school, I only remember the first 3 years of my life, because I started studying for step 1 in my fourth year. I still think that third year, sometime in the mid of third year, I mean, you can start as early as you go into third year. But my advice would be, even if you want to enjoy some time, the strategy is to do an MLE oriented preparation of your professional exams, which means that I remember that I used to study Lippincott for my biochemistry, and that is oriented towards USMLE, or even I'd say even more detailed than you need for step 1. And for third year, I used I studied my micro from Sketchy. I always, it's good to this is what I would recommend. Even if you're not starting in third year, it's better to talk to your seniors, know about the books, buy first aid early. This is what I would advise. Ideally, yes, you can start studying as early as third year, but I wouldn't say first year and second year.
What were the resources that you used for your step 1 exam?
So that was a long time ago. I don't know if that still applies to you guys as well, but as I said, I used Sketchy when I was in third year, and I did Kaplan for pharma. Yeah. I know that's kind of outdated now, but I still think that pharma was pretty good with Kaplan, and it's more than what's required by USMLE. And then my basic resource was, of course, first aid, and I would definitely recommend Boards and Beyond, because I did Boards and Beyond for my step 1, and I think that it's good to lay a foundation. It's not as detailed as something like Dr. Najib, but the good thing about it, it's high yield, it's brief, and he knows what he's talking about, especially cardiology. He's a cardiologist, so that section was pretty good.
Boards and Beyond is really
what else? Yeah, the videos are really nice. So definitely, I used to watch videos of Boards and Beyond first, and then used to study that topic from first aid. I mean, the system from first aid, and then I went on to UWorld and did that particular system from UWorld. since step one is pass fail now, so I don't think this advice or this strategy applies anymore. I mean, you should be jumping straight to UWorld. The max you can do is do B&B, study first aid side by side, and then you jump straight to UWorld, you complete one round of UWorld, and you give the exam. This is what I would do. This is what I would ask my brother to do for step one now. So that's pass fail. So it does not make a lot of sense to, I know, and I understand that most of step two is based on step one, but I think that it's still a lot of things that are part of step one syllabus are still not tested on step two. They're never going to ask you all that biochemistry, all the enzymes, and all the basic stuff. But so I still think people say that if you do a good preparation for step one, it's going to help you in step two. That is true. But the energies might get wasted. High yield stuff that will actually show up on USMLE step two and, just pass step one as quickly as possible, maybe like 3 months.
So for step two, how much time does it take to prepare for step two?
I think it's the most important and challenging exam. People used to say, I remember back in med school that, step one, kar lo, aage aasani hai. But that was not true. For me, I think. I think they are starting to make step two CK comparatively more challenging as compared to step one. I would say that the time does not really matter. The thing is that you need to score good on NBMEs. When you're doing that, I think if it's 10 points above your target score, then I think you're ready for the exam. So this is what approach I usually suggest to people, that instead of looking at that time, you look. I mean, I knew some people who were preparing for step one for 2 years. But the people who did it in 6 months or 7-8 months ended up scoring more. So it really depends on what strategy you use and what kind of person you are. It's hard to put a time limit to an exam. So I would just say that use the scores as a predictor of your preparation.
So what does the exam day look like for step one and step two? That is a question. I think I have that question in mind, and a lot of people wonder what the exam day looks like for step one, especially.
I think it's, you've not, I don't know if Pakistan, I didn't do it, but I don't know if you guys can do it or not. It's the first time you're going in a prometric center. It's kind of overwhelming. I understand that.
Yeah.
In step 2 CK, I mean, the exam was hard. My experience of step 2 CK was a lot harder as compared to step 1, but that is the exam part. The other part, I just knew what I had to do, what's going to happen in there, how things work, how the center is. I think there's only one center in Lahore, so I knew that center. I'd been there for 8 to 9 hours, so it was good that in that sense, when you've been to a place, you've sat in those on those seats for, I don't know, 8 hours. The composure, I think, is very, very important. And the best way to train for it is to, sit on a table in a room that is locked and mimic the actual exam. Okay. I think the NBMEs are 200 questions. So that is 5 blocks. The exam actually has, step 1 has 7 blocks, right? So step 2 has 8 blocks and 1 hour break. So the best way to prepare for it is to, sit and mimic the actual exam, feel the, keep a coffee besides you, time your break. Okay. So even if you have to combine one, and this is what I used to do, one NBME with one free 120, that's another exam. So just so my body is trained and I'm trained to concentrate for 8 hours. And I used to lock the room and I used to time my break as well. So I think that helps. Although I understand the exam pressure is different, but it can help. If someone has the option of, taking, I know there are, they charge you money, but if someone has the option of taking that free 120 in the Prometric Exam Center, I think USMLE allows you to do that, but I don't know if it happens in Pakistan. So you might have to check, but you'll get there. I mean, we've been through all this, so we understand that being on that side of the screen,
Yeah.
it can look very hard, but trust me, people like you have gone through the exam year after year, and they come out successful, inshallah.
With the step one being pass and fail now, what do you think program directors look for apart from the step one score to choose a good candidate?
It varies really from specialty to specialty. This is what I've realized after coming here.
Yeah.
I've not been here for long, but after talking to a lot of people, I've realized that certain specialties require certain sets of skills in an individual. So internal medicine, the most popular among the IMGs, they will look at your scores. Competitiveness in terms of score is, I mean, like, I don't know anyone in, dermatology. I know people in neurosurgery and some people in IR as well. But I mean, like, internal medicine is the, one specialty that is looking at your scores a lot. Mm-hmm. So if you want to do internal medicine, you need to, the competition is really getting tight. So I am applying for neurology. I'm not doing internal medicine. For neurology, I talked to a program director. So he said that the most important thing for us is to see how interested he or she is in neurology. So your CV should reflect that interest in a field, in neurology, for instance. And the same goes, I have a couple of friends who are applying for IR, okay, and they have their mentors and PIs who talk to program directors, and they say the same. I mean, you might think that IR, interventional radiology, even neurosurgery, you might be surprised, but I know a guy who from my med school matched in neurosurgery last year.
Yeah.
He did not have a 270, a 260, but he was dedicated. And that's what they look. If you're invested in a field and you're committed to it, you're willing to give your time to it, then that means everything to that field. I don't know a lot about surgery, but I think general surgery will still look at scores more than anything else. But for competitive, the so-called competitive specialties, what they call neurosurgery, or they're looking more at your dedication than anything else. That's what I would say.
What are your thoughts regarding research, especially in research in medical schools in Pakistan? And do you think that number of publications are important when applying for a match?
The answer to that, the number of publications, is yes and no. It depends. It really helps to have more number of publications. But I think still for competitive specialties, they might look at the quality of publications as well. So they know which journal is good. So, I mean, if you have a publication in a high impact factor journal, it carries a lot of weight, especially for IR. I have some friends in IR, so they tell me that. And I've not been through the match process, so I have limited experience as well. I think for internal medicine, it really depends on the program director, but I don't really see, for internal medicine, there are a lot of candidates. So they have all these filters. So maybe one of those filters is the number of publications. Because for internal medicine, people are trying to get, the number up instead of the quality. And it works.
Yeah.
So I think I read an article on it as well. It was from a surgeon, I think. And he said that quality also matters, but quantity matters as well. I did not do a lot of research back in my med school. And if I look back, that is one thing that I would like to change. So, yes, research, I mean, every program here, no matter a community program, they love research. So it's always have to have some publications. And I would say that it's worth it. You know, the most important thing is to have the skill so
Yeah.
you can be independent. So if you have the skill, you know how to, write a paper yourself and you are independent. This is what I say to everyone: learn to be independent. Do not work on a paper if you're not getting to if you're not learning something from it. So you might do analysis in one paper, write a discussion in the second. That's okay because you're acquiring the skill. And I don't remember working on any paper where I did not learn anything. So no matter what your contribution is, you will always learn something if you're working on a paper.
I think it's very important to get the skill.
Yeah, skill is important.
Yeah.
Because that's going to, pay off in the long run.
So, what are your thoughts regarding a research position? You are doing a research position at Mass General Hospital in neurology. So, what is the process of applying for that, and how can medical students get a position at good hospital?
Yeah. So I think the process is fairly simple, but at the same time very challenging. But I would say that it's a lot of luck as well. So if you shoot the right email at the right time to a right person, that's going to get your research position. The list of all the top hospitals in the US who have a good name in research. And after that, I used to, just go on Google, visit the website of that hospital, and then go to neurology department to look for all the professors in that department. And then it was not easy to find their emails because they do not put email addresses publicly. So what I used to do was put their names on PubMed or uh, Google, and then go to their publications. And I did not find email addresses in publications very easily. So the publications in which they were corresponding authors. So I got their emails uh, through those papers. And then I used to compile a list of, the emails. And I had to send out, I think, close to 70 to 80 emails. I used to get a response from, out of 70, I just got a response from 4 or 5, I think. And they were not offering because they did not have vacancies. So, but I was lucky to get a response from one of them, and that worked. So I know a friend who had to send out 2,000 emails, and I'm not even kidding. He sent out 2,000 emails. So that's why I say that luck matters. So the right person is seeing you. I know a friend who just sent one and got the position. So it's about being, and the best way to get a research position will be to have a recommendation, So to have, if I am leaving next year, I'm on a 1-year term, then I can recommend someone to a PI that I know this person and he has, these skills, and I think he can do justice to this position. And they do consider, especially if you've worked well and developed good mentor-mentee relationship with them, you've worked hard and justified your position, they will listen to you. That is the best way to get a research position.
I think it's about just keep trying and you will get a response someday.
Yeah.
What do you think is the best way to approach a mentor in the US? You talked about sending emails. Is there any other way? Because Pakistani medical students who want to practice in the US want to connect with people over there. They want to find mentorship over there and work with them as well. What is the best way to approach them?
That's a hard question because I did not do that, but looking back, if I had the opportunity, I would.
Yeah.
I do reach out to neurology professors now, and I understand it's not easy, and especially when they're working at good institutions, they always want to uh, uh, want you to give something in return. So it's important for personally, I think that the most important thing if you're approaching a mentor is to have some prior research experience. And with the amount of resources that you guys have these days, you can get all the the skill as well as the number of publications. Okay, so if you have I mean, like, as it makes it's common sense, right? If a person is looking to work with someone, and they have a prior, I will do that, you will do that. It makes perfect sense that it will 1 + 1 makes 2. So they will prefer 1 + 1 over 1 + 0.
Yeah.
So so you need to offer something in return to a person you're approaching.
Yeah.
And again, I would say it also depends on your luck. And I think it's okay to send out emails. You wrote some paper and then you send out to Twitter is a really good medium to connect with people. I know a friend who got an interview because of the professor or the program director in dermatology knew that person from Twitter very much. So I mean, like, if you want to just go through the faculty on the website of that hospital and then follow all those doctors and look what they're doing, and maybe try to be present in front of them on Twitter, that might help as well.
I think Twitter and LinkedIn are great resources to connect with people.
I still think Twitter is a lot,
Met Twitter.
it helps.
Talking about med school and the USMLEs, most of the medical students, they do face burnout. And there is a problem when it comes to managing your work and your life together. So what do you think is a better way to handle this? What did you do and how did you tackle that?
I think life would have been a lot easier if people knew the answer to that. I mean, I can give you 1,000 strategies, but the thing is that it's not easy to act on them. And that is the struggle that most medical students, including you and me, have been facing and will keep facing for I don't know how long. Because if I were to, summarize, if I want to develop something, if there's one word that would, uh, summarize life in general, that is balance. You need to work on work-life balance. You need to balance between relationships. You need to balance how much you want to say or not say, speak and not speak. Life generally is all about balance. A person who is balanced, it's not just limited to academics or your studies. So balance in general in life is what most people, in my perspective, are looking for. So it's not easy, to get this. But I think what I do is try my best. And if you strictly talk about medical school and your studies, so I think the most important skill is discipline. If you can, I know it's easier said than done. Okay, so I've been through all this, and I still am going through all this. So it's not easy to discipline yourself. But I think that if you're disciplined and you know that when it's a good time to study, when it is a good time to party, you can have a good med school life. You know, I would say that being a doctor, you should have this realization that your life is going to be challenging.
Yeah.
So this is how I keep myself satisfied, because I know that I chose this intentionally. This was what I wanted to do.
Yeah.
And I have to know that it comes with a certain price. So, okay, so when you cannot compare a medical student to, I cannot compare myself to all the other friends who are studying in, for instance, slums. I knew, that's why I say that it's important to, that's why I always say that it's important to go into medicine with your own, passion.
Yeah.
And it should be an informed decision, because it takes a lot
Yeah.
to be, go through all this grind. And then, there's a lot of peer pressure. And then, especially if you're going to US, there is a lot of added burden that you're taking on yourself. So it has to be an informed decision. So a person who made an informed decision can, accept more easily that there is a certain amount of sacrifice that comes with this career. And it's not just limited to medical school. That's going to happen all your life, especially if you're working in the US.
Yeah. What changes do you think you want to see in the undergraduate curriculum, especially in Pakistan?
A lot, because it's very, I don't know about your med school, but I mean, like, the students I thought were really good. But unfortunately, that's true for, I think, most Pakistan. It's disheartening to see a lot of bright students, being made to sit in those lectures for, I don't know, 45 minutes, 1 hour, when there's no point. I mean, no disrespect, there were some good teachers at my med school as well, but I don't see a point. I did not learn a lot from the lectures in my med school. I learned skills while working in the wards, but it needs a complete revamp. It's a long rant, but I think the most important thing is to move towards MCQ. In our professional exams is half of the, I mean, like 40% at least are MCQs, but they need to move towards MCQs, because I think that's a more standardized way to test people. And then, but it's easier said than done, because people who are at high positions are not willing to accept that change. So, I mean, like, I can say a lot of things, but I know for a fact that it's not happening anytime soon, unfortunately. But I do think that what we can do at our level is to stay up to date with, use resources like Up to Date. It's a great resource, Emboss Library. And then you have Anki. I did not use it, but I know a lot of people who are using Anki.
Yeah.
So these are the things US medical students use Anki all the time, even in med school. So if you can do that, I think you are, well equipped to to take the USMLE exams. The thing is that US medical students find USMLE exams, they just prepare it, I think, in around 1 or 2 months.
Yeah.
That's what I hear. So it's because their system is oriented towards the exam. So we are outsiders, and we have to shift 180 degrees to but it would be helpful to adapt some of the studying patterns or habits of US medical students, a major one of them being Anki. That's what we can do at our end, because the system is not going to change much in the 10 years, or I don't know for how long.
So in Karachi, in my med school, we have MCQs only in our exams.
That's great. That's perfect.
But
Good.
the classes are the same. I talked to Dr. Noura Sabah from King Edward, I think.
Oh, nice.
So she talked about the
I
same
mean,
thing.
if you talk to her, there's no point talking to me.
No. But she was talking about this as well, that obviously the system needs to change. And I think classes should not be mandatory because obviously everyone has a different studying style. And
Yeah. We've been having this debate for over 100 years, but
I think the system isn't ready. The people aren't ready to change.
unfortunately, the people who have the authority are not ready to change. So with limited resources, we have to work with what we have. And that's pretty much what we've been doing. And that got us here as well. So, I mean, it works.
You're just getting into the clinical side of medicine. How do you see medical practice 50 years from now?
So I think a lot of times you have to accept as a doctor what I've seen and what I keep seeing again and again, it's kind of frustrating, is that physicians have to guess a lot while treating patients. I mean, like 50% of the knowledge that we, I still think there is a lot to learn. Thing is that it's kind of frustrating as a physician to study so much and still not be able to understand what's going on. It's frustrating. I mean, like, it's not UWorld. It's not like UWorld in real world, where you will get, I don't know, a 30-year, 40-year-old woman with sarcoidosis. It's always, going to be, since it's autoimmune, it's always going to be a woman. And these are classical things, hilar lymphadenopathy and things like that. That's not what you're going to have in real life, So it's kind of frustrating, but I think this is the way how medicine is, and you have to accept that there is a limited amount of help that you can provide as a physician, and you have to work with certain limitations. So what I want to see, and what I predict is, like, I don't expect it to go up exponentially, but I think the understanding will change from, like, I don't know, sometimes I think maybe we just know 30% of human body, and there's still a lot that we don't know, that we cannot figure out. So I mean, like, if in 50 years you can make a 10 years progress, that I would be surprised. So that's but I think it's possible if you look back. I mean, I was talking to my attending the other day, and he said that 20 years ago had 4 or 5 medications for epilepsy, and now we have 30 in the market. So I mean, that is in itself a lot of progress. Being able to switch people to a different medication if their seizures are not controlled, that is a privilege, So that's one thing where I want to see medical practice get better, and I foresee that we will see an increase, at least some increase, in that understanding of the disease.
I think it will just get better, inshallah.
Yeah, inshallah.
Thank you so much for coming and agreeing to do this interview. I hope that we can have you soon again on the podcast.
No problem. Thank you.